What's going on, everyone? Welcome to today's pandemic update for Monday, May 15th, 2023. Hopefully everyone's staying safe. If you had to take a COVID test, hopefully you have tested negative and not positive. We do have one COVID positive to report on today, and that is a Ramco Ivetical, who is a bicyclist. He has tested positive and actually had to leave the race and go home, so he will not be competing in the Giro d'Italia as he has tested positive for COVID. Moving on to this, India today added another 801 new cases, and they also added another 8 deaths in the last 24 hours. So India cases continue to drop, which is some good news. Now moving on to this. Remember previous videos I keep saying we don't hear too much about the J&J vaccine anymore? Well, check this out. Now we are hearing an update on the J&J COVID vaccine, and it turns out the COVID vaccine from Johnson & Johnson is no longer available in the U.S. The final doses that were left have expired, and they're saying, CDC says, they need to be disposed of. You cannot use them anymore. So no more J&J vaccine. It's either Pfizer or the Moderna vaccine, or if you're lucky enough, maybe you can get yourself a dose of the Novavax vaccine. But that is it. We are not going to see the J&J vaccine in the U.S. anymore. Moving on to our next story, and this is interesting. Long COVID linked to vitamin D deficiency. So it turns out, at least this study says, that a lot of people who are getting long COVID also have issues with low vitamin D levels. And that could definitely be a reason why a lot of people post-COVID are very tired constantly. It also says here, long COVID is affecting 50 to 70% of patients who were previously hospitalized for COVID-19. I didn't see anything here about the mild cases that don't end up in the hospital. I hate that word mild. The less severe cases. But that's interesting. They're saying here in this study, 50 to 70% of people who are hospitalized get some form of long COVID. That is extremely concerning. That's a really high number of people. And it's saying here, people should have their vitamin D levels checked post-COVID. And I know I, for one, post-COVID, and still to this day, constantly have low vitamin D levels. Some people are taking very high dosages of vitamin D. Some people are getting intravenous's with a liquid solution that's helping them. I mean, there's a whole bunch of things that people are having done post-COVID. Alrighty, moving on to this now. I thought this was interesting. I posted something this morning. I shared something from my site that someone posted about, and they were asking people's opinions. How are you seeing masking in your area or outside of your area? And so I shared it on Twitter, and I said, you can put a response here or on the website. And this was one of the responses I got, and I found this out. That take a look at the wastewater in Japan. It is rapidly rising again. Look at this chart. It is literally going straight up again, so that is not good to see. And we'll take a little bit more. We'll take another look at Japan when we get to the international update at the end of today's video. Alright, moving on to this now. On Monkeypox news, we have a few things in Monkeypox today. New Mpox cluster in fully vaccinated people has New York City ties, CDC warns. So remember those cases that popped up in Chicago? I believe there were 13 of them. Well, some of them have ties back to New York City. Let's read on this. Between April 17th and May 5th, doctors reported 13 confirmed or probable cases of Mpox to public health authorities in Chicago. All the cases were in men, all had symptoms, and 9 of the 13 were previously vaccinated with two doses of the JYNNEOS vaccine. Genos, I guess that's how you pronounce that. Travel history was available for 9 cases. 4 recently traveled to New York City, New Orleans, and Mexico. So, if we know that the cases came from these other places, such as New York City, New Orleans, or Mexico, this could lead us to believe that there may be other cases out there, because they had to get it from somewhere. I mean, they didn't just magically get monkeypox on their own. They had to have contracted it from someone else or something. So this is concerning, and this does lead us to believe that we're probably going to see more cases popping up pretty soon, because remember, the incubation period, or the period of time where you could contract symptoms or even test positive, that's as high as 24 to 28 days, or at least it was last year during the wave. So the next month is going to be very critical to see what happens with monkeypox, to see if we see, or they call it mpox now. I still like to call it monkeypox because that's what it is. It's very critical to see if we see this develop into further cases or a full-blown wave, which it's looking possible that may happen. Moving on to something else with monkeypox. Mpox outbreak not over, warns CDC amid ongoing community transmission. It says here, America's monkeypox outbreak, Mpox outbreak, is not over and could see a resurgence over the coming months. The Centers for Disease Control and Prevention said Monday, ramping up their warnings after reports of ongoing community transmission. So the CDC is already warning this could turn into a wave. And this follows the cluster that we saw about in Chicago. But here's one of the things that they say. Spring and summer season in 2023 could lead to a resurgence of Mpox as people gather for festivals and other events, the CDC said in an alert, echoing the earlier prediction by the agency's modelers. And look at this. This is interesting. At least 36 new cases have been diagnosed over the past month around the country. So never mind with those 13 cases in Chicago. It's now up to 36 cases across the country. But again, we do know that there were some cases in Los Angeles. We know about Chicago. We know that there's ties to New Orleans and New York City now. Where would the other cases be from? They don't say. I wish they would say each state that the cases came from, but we do not know that yet. So hopefully we can find that out in the coming days. Alrighty, moving on to this. We're just going to read the headline here. Alcohol-based disinfectants can effectively protect against the monkeypox virus. So that is some good news. Alrighty, that does it for today's news portion. I did want to share this. This is about ventilation in buildings. I think we're going to actually probably do a separate video on this. CDC has made some changes to their recommendations on ventilation in buildings. Yeah, surprise. Funny that they changed that after the pandemic emergency ends and changed it to something that we already knew was effective. More on that in another video. I wanted to give you a Walgreens update video today, but Walgreens has not updated. If they do update, I'll get a video out on that maybe late today or tomorrow, depending on when I release that other video for the ventilation. Moving on to this day in COVID history. On this date, on May 15th in 2020, this is what happened in pandemic. New estimates from a University of Michigan study revises the survival rate for people with COVID-19 who are put on a ventilator from as low as 10 to 12% to between 25 and 50%. CDC's Chief Health Equity Officer officially joined CDC's COVID-19 response. This is the first time in the agency's history that a senior leader within the incident management structure has the sole purpose of advocating for greater health equity across the entire emergency response. CDC distributes a warning for clinicians through the Health Alert Network, describing multi-symptom inflammatory syndrome in children, a serious inflammatory condition that affects children with current or recent COVID-19 infections. And very strange, again, this was May 15th of 2020. That early in the ball game, they were already talking about issues in children, but yet they continued at the time to say that COVID was not a big deal in children. Very strange that it worked out that way. Taking a look here at wastewater, not much to report on wastewater. Everything is pretty much the same from our most recent update, which we did yesterday. Taking a look here at the last 6 weeks, you can see all regions are relatively flat to slightly dropping. Taking a look here at the national level, again, not much has updated, so we'll just skip over this for today. Taking a look at the varying proportions, as you know, XBB XBB.1.5 is 64%, XBB.1.16 is 14.3%, XBB.1.9.1 is 9.2%, XBB.1.9.2 is 4%, XBB.2.3 is 3.5%, XBB.1.5.1 is 2.4%, and FD.2 comes in at 1.8%. All right, taking a look at this from HubUp data. In Maui, this is Hawaii, there is an increasing moderate level of prevalence for COVID. So their forecast is that there could be a mini to moderate wave there in the upcoming week. So that's interesting to see. Let's take a look at New Jersey. 153 people in the hospital for COVID. That is down. So it's good to see New Jersey hospitalizations dropping after that short rise that they saw last week. 9 people on the ventilator. In the ICU, 28 people are in the ICU. And taking a look at the latest cases and deaths in New Jersey, 74 confirmed cases, 30 probable cases, and 1 added death. I don't know if any of that includes Sunday's data, because they didn't update yesterday, so I don't know if that includes yesterday's cases or not. I'm assuming it doesn't, since it is such a low number. Alrighty, moving on to this. Now, Philadelphia yesterday added another 701 EMS calls. That is actually significantly lower than what we have been seeing recently, and the weekend total is lower than the previous weekend at 1,441 EMS incidents in my city, so that's good to see. One to show Mountain and Knee Medical Center, but as you can see here, they haven't updated yet, so we'll get that in tomorrow's update with the weekend totals and today's number as well. Taking a look at New York State, 341 cases were added, 2.5% test positivity rate, and the 7-day average is 1.8%, so that 2.5 is significantly higher than the 1.8%, and thus explains why cases are so low, because the positivity's up, not enough people getting tested. Moving on to hospitalizations, and hospitalizations to end last week did rise. 543 people in the hospital, and in the ICU, 58. So that did rise. It'll be very interesting tomorrow to see if it rises any further, because remember, wastewater is starting to rise in the New York City metro area. All right, taking a look at the international update here, and one of the places we will look at is Japan. And first off, South Korea cases are up 22%, deaths are up 58%, France cases down 23%, deaths down 38%, Australia cases down 24%, deaths down 26%, Vietnam cases are up 5%, deaths are flat at 5%, Philippines cases are up 17%, deaths are down 100% because they've reported no new deaths. Italy cases are down 44%, deaths are down 47%, and Japan, this makes no sense. I'm thinking, one, they're probably not reporting, or at least not reporting often enough, and 2, maybe they're not testing enough. Cases down 86%, but yet we saw wastewater. Wastewater in Japan is rapidly rising. Deaths in Japan are down 64%. India cases still down 54%, and deaths are down 41%. And disclaimer here, some of these numbers may be behind. They may not be up to date. That's okay. It's just giving us a general idea of the trend. And Germany, cases down 11%. Deaths continue to be up 27% in Germany. I'm concerned about Germany. We need to do some research to find out why that's happening, because in the last 7 days they've had 422 deaths. That's like the United States having 2,000 to 2,500 deaths in 1 week. So that is truly concerning that they're having such high number of deaths at this stage in the ball game, when they're not even having that many cases. So that is definitely something we need to look into. Alrighty, folks, that does it for today's pandemic update. I may have a Walgreens update later in the day, or if not, we'll definitely do something on that ventilation changes. I want to tell you about that. I mean, I'm surprised the CDC's finally changing that. Go figure, after the emergency has ended. So that does it for today's pandemic update. If you like this video, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below. I'll see you all again next time. But until I see you again next time, stay safe, everyone.